35%. That's a big number. Well, the number of stroke cases per year and their mortality will increase by more than 35% in the next 15 years. This is a research made by the Spanish Neurology Society. Hello, my name is Fernando, and in collaboration with the Foundation for the Research of the Hospital University of La Paz and its Neurology Group, and also the Robotics Department of the Technical School of Telecommunications here in the UPM in Madrid, we came with an automatic and objective system for measuring kinematic variables of hand movement in patients with cerebral stroke. So we detect some needs. These needs are the clinical scales aren't neither sensitive, neither objective, and also neither discriminative. And also that the current device, they are not very light, they are so bulky. So we came with this outcome to create an objective quantification of functional deficits and use a tool that doesn't need to have or to place sensors or other device on the limb. So talking about some about of the start of the art, we came with a conclusion is that all the devices available, they are not focusing exclusively on diagnosis, but they are focusing more in rehabilitation, and they are also very bulky, as we can say here, as we can see in these examples. So, what materials do we use? Do we use the most modern materials and the most the best device that best suit the needs we have? So, why do we select the Leap motion controller? So, the Leap motion controller is a tiny device that only weighs 32 grams and has two near infrared cameras. Also has a long and big characteristics that make this device unique, that are the rate frequency, that's 2040 Hz, and also the very wide point of field of view. So what's the functionality of this device? Well, this device allows virtualization of our hands in 3-dimensional and also can be exploited to obtain all the desired kinematics data. So we designed the stroke data tracker. This stroke data tracker is a tool that the clinicals, the professional of the health field can use in order to do an objective exam of the clinical disease, such as, for example, ictus or the cerebral strokes. So this is, for example, one of the exercises we select from. We correlate with some clinic scales, and we come with, for example, this implementation in real-life patients, where you can see is that the patient has a deficit, a motor deficit in their hands, and he couldn't move the left hand very good. So we track the data and we get all these kinematic data you can say, as you can see in these graphs. After we finish the application, we process the data and we create some reports. These reports are made to be very quick to read by the clinicals, and also have all the exercise detail with like, as you can see here, range of normality, in order to compare it and get also an evolution of the product. So what are the conclusions? Nowadays it's currently being tested with real patients in order to validate this idea. It has a big potential, and also to end this subjectivity of the clinical case and make, that's the most important part, make the diagnosis quicker, so much quicker than it's right now. And what could be in future lines? Well, if we can adapt it for mobile or tablet device, it could be great. Also, to create a unified database, so all the clinics and hospitals involved can put the data there and build a larger data set with to trace more effective validation route. So what we can do it with this data is to try neural networks with this data set we have created and create artificial intelligence algorithms to automate the diagnosis in order to provide a doctor with the most important part of the device, that is to create a second opinion reliable for the doctor. Thank you very much.